and now I'd like to invite Dr. Sonia Morrissey. She works at Melton Secondary College on the Doctors in Secondary Schools program. She's just going to give you a 5-minute overview of what you do in your practice and how, how it differs to what it's like normally, and I guess why you really like working on the Doctors in Schools program.
Okay. So firstly, I suppose I came to Doctors in Schools having already worked for some time in young people's health. So I'd worked for a long time in Melton in my community young people's health service. And I also work at Headspace in Craigieburn and Headspace in Melton. And I've been involved with our local secondary schools doing some health promotion programs on behalf of our practice. So we sort of had some established links already with some of the schools, which made things a little bit easier. So I like working with young people. I find it really rewarding work. I think it's an amazing opportunity to intervene early with health conditions that we know will present at that time. So 75% of mental illness will present before the age of 25. It's a real opportunity to get in on the ground, and we know that this is a group that often won't come to see us in our normal practices. I find it really rewarding. It's really interesting. It's quite different in different settings. So I work mainly at Melton Secondary College. I also work occasionally at Currajong Secondary College in Melton because we've got a registrar who works there, but I sort of cover for them and things. And I've also done some filling in at Mount Ridley College in Craigieburn. And it's quite different in different communities. So I think the 40% psychosocial is low for what I see in Melton. So I would say probably up around 80 of what I would see, because it's predominantly psychosocial presentations. Sometimes at Mount Ridley, they would come the first time with concerns about their skin, or they're a bit worried about, they've had some sort of vague sort of headache sort of symptoms, and they get to know you and they kind of see that you're okay and they feel comfortable, and then they'll come back the next week and say, actually, I'm not really sort of sleeping well and I've got some other sort of things going on. I've found it a really great experience working with the staff at school. It can be really challenging managing the communication just because we're there for a really small period of time and then we're not able to be, easily contacted. We do, I think it is a relatively broad range, and the school staff are particularly the wellbeing staff, the ones that I work at, are really important in being able to follow up the plan for care, because I'll be sort of walking out the door and we've got young people who are sometimes quite risky and needing on sort of referral on, and they're, with the young person's permission, we'll then involve them as part of the team for sort of caring, and so I can sort of walk out the door and the wellbeing staff member will then take on making sure that we can get hold of the parents if I've not been able to get hold of the parents in the consult to talk about what particular concern we've got. So I think that those relationships are really key. There's a few practice things around, like as Lena said, around making sure, so we have an automated system in our general practice where if you click on a result saying abnormal, automatically an SMS is sent, so we've had to modify how we handle results for the young people that we see in the clinic. I actually have found that there are some young people who started seeing me in the school setting and after that just decided to come and see me at the general practice. And so, because actually that was easier to come after school, or then mum could come with them and talk, and they wanted mum to be involved.
Wonderful success, isn't it?
Yeah.
To be able to bring back to mainstream.
Yeah. And it's and I've sometimes will have parents who come to the school to come to the appointment with their young person because they really wanted to be involved. So I found it a really rewarding experience. I'd highly recommend it. There's lots of support. The training is actually really fantastic, and I went and did the training. Lena very, very, very generously suggested I probably didn't need training, but I actually got lots of stuff out of it. And the working with the young people was really interesting because it did change the way that I did the confidentiality statement a little bit, because I think up until then I probably didn't open with it. I would certainly talk about confidentiality, but I'd start with more general questions and sort of talk about confidentiality when we started talking about sex, drugs and rock and roll, as I like to say. But I now lead with that. So I've now got this. So in the school setting, for example, because almost always a young person's there on their own, I'll say, hi, I'm Sonia, I'm the GP here at the clinic. Do you want to come in? We're going to have a chat. Do you understand how confidentiality in GPs work? And sometimes they'll nod and I'll say, okay, so that means that whatever we talk about, and then I do my little spiel. And I now do that right at the beginning. And that was because in the training, you get an opportunity to do role play, which I know everyone goes, but it's actually, because I hate role play, but it's actually very non-threatening because you're all doing it simultaneously at the same time. So you're just role playing with your pair, and everyone else is just, so no one's watching you. And it's an opportunity which we don't get as clinicians to practice that interaction. So you could ask questions and then say to the young person, what did that feel like? Was that weird that I asked that then? Was it weird that I led with that? Should I have said it somehow different? And they would give us really honest, really constructive feedback. So it was a really valuable experience. So I would highly recommend it. And for practices who have registrars, it's actually a really great learning experience for registrars. So we've specifically now got an extra registrar at our clinic who was there as it's a GP placement, but it's a GP / young people's health. And so as part of their placement, they come with me to do some health promotion stuff in schools, and they do one of the doctors in schools clinics.
What level do you have to be to register that?
We made a decision that they'd have to be at least GPT 3 or 4.